Chapter 4: The Sick Care Business. How the Profit Model Sabotages Prevention. The American system isn't a healthcare system. It is a sick care enterprise. Its greatest profits are not found in keeping people healthy, but in managing their chronic, expensive diseases. A healthy population is, perversely, a terrible customer base. This chapter exposes how the insurance industry's financial incentives are structurally aligned against preventative and well care, creating a system that waits for you to get sick, because that's when the real revenue begins. The perverse incentive: profiting from sickness, not health. The fundamental economic flaw in the for-profit insurance model is that its revenue, premiums, is largely fixed, while its costs, paying for care, are variable. Therefore, the most direct path to maximizing profit is not to ensure a healthy population, but to minimize the payout for any given member. The medical loss ratio: deception. The industry itself revealingly calls the money it spends on patient care the medical loss ratio. In their accounting, every dollar spent on a doctor's visit, a screening, or a medication is a loss against their premium revenue. This terminology exposes the core conflict. Your health is their financial liability. The Affordable Care Act requires insurers to spend 80 to 85% of premiums on medical care. This rule, the medical loss ratio, unintentionally locks in a backwards incentive. If premiums rise, insurers keep a larger slice of a much larger pie. If healthcare spending doubles, their profit doubles. If it explodes, their profit explodes. To illustrate this point, take two scenarios for a health insurance company operating under the medical loss ratio rule, which requires them to spend 80% of premium income on patient care, allowing them to keep 20% as profit and overhead. In a healthy population, the insurer collects $5,000 per person in premiums. They must spend at least 80%, $4,000, on care, leaving them a $1,000 profit per person. In a sicker population, to cover the higher cost of care, the insurer charges much higher premiums, $15,000 per person. They now must spend 80%, $12,000, on care, but their profit jumps to $3,000 per person. The key insight: even though the profit percentage, 20%, remains the same in both cases, the sicker population is 3 times more profitable in absolute dollars, $3,000 versus $1,000. Under this system, health becomes a financial liability. Sickness becomes a guaranteed revenue stream. The chronic illness goldmine. While an insurance company might lose money on a single catastrophic event like a car accident, the real, predictable, and massive revenue stream comes from managing chronic diseases like diabetes, heart disease, and cancer. These conditions require a lifetime of drugs, specialist visits, and procedures. A system focused on preventing these conditions would evaporate a multi-billion-dollar revenue stream. As one health economist noted, "There's no money in a cure. The money is in the treatment." The bureaucratic barriers to prevention. The denial playbook, detailed in Chapter 2, is actively deployed against preventative services, creating a gauntlet of obstacles that discourages both patients and providers. Prior authorization for preventative screenings. Despite guidelines recommending routine cancer screenings, insurers frequently require prior authorization for advanced screenings like MRIs for high-risk patients or colonoscopies. This creates a delay that can be the difference between Stage 1 and Stage 4 cancer. A 2024 survey found that over 30% of physicians reported that prior authorization requirements had led to a patient's hospitalization or a life-threatening event. Skimping on well care. Visits. While the Affordable Care Act mandated coverage for annual physicals, the reimbursement rates for these visits are often so low that they don't cover a physician's overhead. This discourages doctors from spending the necessary time on comprehensive health assessments, lifestyle counseling, and patient education, the very pillars of preventative medicine. The human and economic cost of neglecting prevention. The consequences of this sick care model are measured in trillions of dollars and millions of lives. The chronic disease epidemic. Chronic diseases, which are largely preventable through diet, exercise, and early detection, account for 90% of the nation's $4.5 trillion in annual healthcare costs. This is not an accident. It is the business plan. Health disparities widened. The barriers to prevention hit marginalized communities hardest. As established in Chapter 3, denial rates for preventive care are roughly twice as high for Black and Hispanic patients. The sick care system actively worsens the health inequities it then profits from managing. The single-payer antidote, aligning incentives with health. We expand on the single-payer solution in Chapter 6 and discuss it here, because a single-payer system fundamentally rewires the sick care incentives. By removing the for-profit middleman, the goal of the system shifts from minimizing medical losses to maximizing population health. The business case for wellness. In a single-payer system, the same entity that funds preventative care also bears the long-term cost of chronic disease. This creates a powerful financial incentive to invest in wellness, nutrition, public health, and early intervention. $1 spent on a smoking cessation program today saves tens of thousands of dollars in lung cancer treatment tomorrow. Eliminating the bureaucratic barrier. With one set of rules and no profit motive to deny care, the prior authorization gauntlet for preventative services can be eliminated. Doctors and patients would be empowered to make decisions based on medical evidence, not corporate accounting. The sick care model is not an unfortunate byproduct of the hostile takeover. It is its most insidious achievement. It has created a system that is not merely indifferent to our health, but in many ways financially dependent on our sickness. Reclaiming our health requires dismantling this business model and building one whose success is measured by how few of us get sick in the first place. The system is designed to confuse and exhaust us, but understanding it is the first step toward changing it. If this investigation into the denial machine and its human damage resonated with you, if it made you angry, or if it clarified something you felt but couldn't name, then your next step is crucial. Like this video, it tells the algorithm that these truths need to reach more people. Subscribe to the channel. The takeover of our healthcare is a multi-layered story. In our next segment, we will dissect the political protection racket that keeps this profitable system in place and build the case for a real solution. You are not just a patient or a consumer. You are a citizen, and it is only when we demand something better that we will finally get it. Subscribe now and join the fight.